Yes.
Okay, great. Okay, let me go ahead and get that done. And I will give you the keyboard and mouse there.
All right. Sounds good. So we've been in business since 2002. The system is extremely customizable. If you see here, we have an architecture diagram. Ramesh, I don't know if you can click on that. I don't have my control.
Right.
Okay.
I did.
So as you can see, we have the EMR, the application, we have patient portals, we have employer portal, department portal. So the employers are able to log in, get the work status, etc. Excellent employee portal where you're able to communicate with the patient, post labs, be able to do telemedicine as well is all an integral part of the system. And we host, most often it's hosted on our infrastructure on Amazon Web Services, but we are very flexible in that it can be client server based. We can also consider other hosting options as well. And so the system is very depth. There's a lot of properties that you can turn on to make the system be the way you want it to. And Ramesh, I don't know if you want to move to the next slide there.
You have the control now.
Oh, okay, thank you. So specifically in the occupational medicine area, of course, it's going to allow you to do complete streamlined documentation. I'm not sure, I believe you also have employer customers as well as in-house clinic. You can have multiple protocols for your different employers. So if there are certain steps that need to be done when a patient is coming in for a pre-employment physical versus a DOT exam as it relates to a certain employer or a certain department, those screens that you need to see and that the providers need to see will be immediately in front of them. It walks them through in a very, very quick fashion. All of the government mandated forms, whether federal or local, those forms can easily be added into the system. So it produces those for you. So very detailed. Other features, you have the nice ability to sign consent forms electronically. Patients can sign those via the portal in the waiting room. Advanced order management for your labs, radiology, consults, all of those things can be tracked. And you have a variety of different ways to do the data entry, whether it be with point and click templates, with speech recognition if you're a Dragon user, or M-Modal, any of those other ones that you might use. E-Prescribing with SureScripts is built into it, etc. So there is a lot there. And of course, we do deal with the registries for immunization, for being able to check on the controlled substances that patients might be taking as well. Telemedicine, I already mentioned, is a nice integrated part. We don't rely on Zoom. We have our own HIPAA compliant video component, keeps track with the patient of all of the workflow that needs to be done. We have an excellent team that is always improving support. So we have standards that we try to adhere to, and we have a support leads group that ensures that the employees, our support group, is taking care of any issues very quickly, and they're prioritized based on what impact it might have towards business. And so we have these statistics that we're constantly going over to make sure that our customers are satisfied. We have our response scores, as you can see, regarding each of these items. And then some of the customers that we already have, we have many, but some of the larger names here you can see, like Massachusetts Bay Transportation Authority, Syngenta, Tucson Electric, etc., San Bernardino County. These are all using Prognosis in their clinics. And with that, I will turn it over to you, Monica.
Okay, let me share my screen. All right, so I am going to go ahead and jump right in since we are running in time here. So new hire, ability to complete a health history form. So we have multiple, as Kent mentioned, ways to enter data. We do have a kiosk-based system where you can actually arrive your patients for their visits or your employees and take them directly into the paperwork, which we will go through in just a moment. You can also have your employees signed up automatically for the patient portal. So when you register a new employee, they can receive an email, look something like this, and this email is customizable, which gives them instructions, and you can ask them to go to the portal, fill out their paperwork prior to their visit, so on and so forth. When they log in the first time, it will ask them to immediately change their password so they have a secure connection. And so I've already done that. I'm going to go ahead and log in as a new patient. What this does is takes us through a specific workflow, and you have a step-by-step process here. So you can determine what you want that workflow to be, what steps you would like your employees to go through, and you can give them the ability, for instance, to edit their personal details. You can also have them complete patient forms, so we can create HTML input forms which gather specific information that you would like them to complete. We have forms for specific things such as workers' compensation accidents. You can also have a general history questionnaire. And then if you have any specific questions related to your particular company, your particular industry, you can also have those patients complete those forms, submit them to you. If there are a series of forms that you need them to complete, they can do submit it next. You can also have them sign legal documents. So if you want to have them sign a HIPAA consent form, drug screening forms, any sort of form specific to what you guys need, we can customize these forms and have them available. So basically the employee would click that and then fill in each of the items that need to be filled in, submit that to you. You can also have them upload documents. I believe part of this was submitting copies of their immunization record. So we can customize these categories here. So if you have specific things that you would like them to be able to upload, you can give them the ability to come in here, attach a specific document. It gives you the ability to identify a document within your computer. You can then upload that directly to the patient's file. So this actually goes to the provider or a specific designee within the practice to be approved and then added to the patient's record. So again, you can choose what you want those categories to be, give them specific instructions on what you would like them to be able to upload. And then this is our established patient home screen. So depending on the modules that you need, they can do things such as schedule appointments, send and receive HIPAA compliant messages. Typically in an occupational setting, you're not worried about patient balances or anything like that. So essentially that piece just goes away. This would be the contact information for the provider at the clinic. Health reminders, we'll talk about in just a moment, is utilized for the surveillance area. And then other items such as medication refills. If you allow them to see any of their records, you can share those here. And again, you can determine what of these items you would like to utilize, and anything that's not appropriate for what you guys are doing, we can basically turn that off. All right, so rolling into the EHR, the next option we have is scheduling a physical exam. So you can view the schedule by custom views. So you can set up specific providers or locations side by side. You can also view an individual provider for a day or a week. All of these items here that you're seeing, such as the time increments for the visits, the colors, the types of visits once we get into it, are customizable to be specific to your practice. To schedule a patient, you just double click the time slot. If it's a new patient that has not yet been registered, this is what we call our quick register button. You simply click here and fill in name, date of birth, gender, if applicable, employer, and then contact information. And the only things that are required at this point are these 4 pieces of information, but that can be also changed. If it's an established patient, you can either start typing their name or choose from the list of patients here, Once you have picked the patient that you would like to schedule, then you're able to pick what encounter type you would like. So if this is a physical examination, you can then pick that particular type of visit if you would like. We also have employer protocols, and these give you the ability to determine what items are required within a specific encounter. Those can be related to forms that need to be completed. They can be orders that automatically get entered, so drug screen orders, or orders for spirometry testing, respirator fit testing, things like that can automatically be added based on what you put into the system here. And here's just a view of this particular pre-employment physical protocol. And you can remove anything that's not applicable. So if there's something that's age and gender appropriate, you can actually remove that directly from there. You have the ability to put in reason here. Question?
I'm sorry, yes, I have a question. This is Sue. So we would expect to interface with our ERP system to pull in our associates. Is that possible?
Yes.
And then they would be available in that drop-down list?
So as far as interface with your, employee, yes, we will be able to do that. In fact, we have responded that in the part of the RFP. And when you select the drop down, you will be able to see list of all your employees in there, or you will be able to search on them. Are you referring to this list that Monica is showing you?
Yeah, I just wanted to be sure because she just mentioned, if you've never seen them before, and I was just thinking new hire. We haven't seen them before, but they should be in our HR system by then. So I just had a disconnect there and wanted to be sure that we were talking about an interface to our Oracle system.
Yes. Yeah, we have interface with like systems like PeopleSoft and other systems before. So as long as the other system has the capability and cooperative in terms of making that happen, yes, we'll be able to do that.
Okay, thank you.
Also on this screen, you can add reason, instructions. We do have a waitlist functionality, so if you need to add patients to a waitlist, you can. And then we also have a really nice search function. So if the patient needs a specific day of the week, or if you're looking for a next available appointment, you can come in here and find the next available, again, on a day a week, specific location, specific provider, instead of surfing through all the scheduled days. Once you have everything set the way that you would like it, you just hit the schedule button, and it puts the patient on the schedule for you. Okay, incoming scan and faxing. So we do have integrated faxing within Prognosis, both incoming and outgoing if you would like them. You can attach things locally. You can also upload. We have a program called Prognosis Uploads that will automatically take anything that you scan and from a folder bring it directly into Prognosis. So you can have a scan folder of specific items that you would like to have someone review and attach to a particular patient's record. You can also have a fax folder. If you have multiple fax numbers and you want to keep those separate, you can also have multiple folders here. So your items that are coming in, you are able to choose the patient that this goes to, attach it to that particular patient, decide what type of document, and these lists are customizable as well, so you can decide what item it is. If it's something that had an order number, you can attach it directly to that order, closing it out, document other items such as who it's from, message it to a user within the system if necessary, so on and so forth. So as things come in, you just select the item, attach it to that particular patient. So I must have something with an order. Let's pick something that doesn't require an order. There we go. And I didn't put the date in. There we go. Let's pick letters down. So once you attach it from there, it drops off your list, goes directly to the patient's record within Prognosis into their document list. You can also, as I mentioned, attach local items. So you can go to this scan local. A scanner attached, and so you can pick which patient you would like to attach it to. These are the same choices as the previous screen of the different types of documents, date, then you would pick local attach, and then choose from the file on your computer right here. Then attach it, same process. To send a fax from the system, we have a mechanism called Letters Out. And from this screen, it takes you automatically to the last encounter patient that you were on. So you can change that patient here if you would like. And then from this screen, you can have a number of form letters that have specific information, so things like work excuses. This is also the area where we would typically send return to work letters or anything that needed to be sent directly to someone via fax or encrypted email. We also, as Kent mentioned, have the employer portal. And even though you're not at this point utilizing this for outside employers, you could use it for internal stakeholders. And that gives you the ability to send and view records in HIPAA compliant format. So similar to the patient portal, except this would be someone at the employer actually reviewing the information. So depending on which workflow is the most appropriate for your organization, you can come in, pick a letter here, attach any documents from the patient's chart. So if there's anything specific that needs to be sent, you can attach those items. You can also attach things such as a demographic sheet for the patient, a copy of their insurance card if necessary. Anyone who's loaded in the patient's record already would be in this list. So this is kind of the patient's address list. And so if that person is in here, you can hit go. It will populate that information. Save. You can either fax with this button or use this to send encrypted email. If a fax does not go through, you immediately receive a message in your inbox. So each user has a messaging system which can be used for multiple things, notifications such as a failed fax, also communication with your associates from the patient portal. So those would go into that user's inbox. And we have multiple routing mechanisms for that. So if certain people need to receive certain types of notifications, they can be routed to the appropriate party or multiple people within the organization. When interfaced results come into the system, so depending on how we interface and what we set up, there's a couple different options here. So we have our document list, which essentially is equivalent to a paper chart. So if you were to print everything within this document list for this particular patient, it would be a paper chart. So anything that comes in via interface is going to come here so that it's attached in the patient's chart. And depending on how we set things up, it can also be organized into the category and description that you want it to. And ideally, this is how we would also load your historical information. We also have a mechanism for labs and radiology from a separate perspective where those items can come into a review list. So these are our 24 labs that need to be reviewed and 5 radiologies. So when you go to that button, click that button, you are drawn to this screen, which then gives you those results. So this is a discrete data example. This is a PDF attachment. You can do either or both, depending on how you like to view and determine which of those pop up first. And then we also have a really nice matrix view where you can see side by side different results. So this just happens to be a drug screen, but this can be utilized for any sort of laboratory test. From here, you can also set their health maintenance due date. So we'll talk about that in a little bit later when we get down to the surveillance program, but I just wanted to show you while we were here so you could see this is a health maintenance event or surveillance event that was set up for this patient, so we can actually add the results that shows in the patient's record for this item that was due on that date. From here, you can mark that it's reviewed, add comments, assign a task, so you can actually send a message to someone within the system that they need to do something with this, add additional comments there, and add that to the patient's record. And then you can also create a follow-up order. So if there is something subsequent that needs to be ordered related to this, you can do that directly from this screen. Radiology works exactly the same way. Are there any questions on the interface results? Does that kind of answer the question? That can be kind of a broad topic. So I just want to make sure if there was a specific question that I cover that.
I think just to be clear, you can interface with an external lab, right? Like LabCorp, Quest.
Correct.
And we can, okay, perfect.
Yes, we've interfaced with about 120 labs, I believe. And LabCorp and Quest are top of the list for sure. Most of our clients are interfaced with one of those. All right, so historical data. So historical data, again, if it is a document-related data, would go into the document list. So into the specific category that you would want, we have a process for having those auto-upload to the location, and we have a data migration team who will assist with that. We also have what we call face sheets, and so you can have 9 face sheets within your system, and those can display specific information and pull specific things. So we have kind of some canned categories that pretty much come with the system, such as medications and things like that, but we can also customize that so that you're looking at specific information. So this screen is intended to give the providers an at-a-glance, everything they need to see before they see the patient or before they complete forms or paperwork, things like that. So basically, we can also utilize this section to upload that historic data and give you that screenshot of exactly what you're looking for. And then I have a question about the external email incorporated into Prognosis. Are you looking specifically for the messaging within the system to go to external email versus utilizing the internal messaging system?
I think what we're looking for there is just to be sure that whatever the workflow, whenever the workflow generates an email, it's Google compliant, because we're on Gmail and we're in a Google shop here. So just making sure that any kind of outgoing emails can work with Google.
Sure, absolutely. So yeah, absolutely. So a majority of the communication happens within the system. So sending a message from one user to another, obviously that stays HIPAA compliant. We do have emails that get generated, for instance, that email that would have the associate log into their portal account, so on and so forth. So all of those, nothing that comes from the system brings any HIPAA-related information to it without being encrypted. So I don't see any issue there. However, at this point, these messages stay within the system and don't go to your regular email. You'd have to log into Prognosis as a user or provider of the system to see that email. However, that is something that is on our product roadmap to integrate with Google and hopefully Outlook as well. So.
Okay.
All right, so rolling right into post-hire. So we have, so a lot of what we do for our occupational clients is very customized. So I have an ADA accommodation approval form. We have a denial form and some other things. We don't have all of them in the demonstration database, but it just kind of gives you an idea of what we can do. So we have a couple of different formats for data input into Prognosis, and this is a template-based system, and I'm also going to show you what we call doctor forms in just a few minutes in relation to a couple of the other things, so you can kind of get an idea of the 2 different user interfaces. But essentially, any of these types of things, such as ADA accommodations, anything that is in here that is a field can be pulled into a report. And I'm going to kind of save the reports to the end and kind of go over those all at once just for the purposes of timing. But we'll show you some of those pieces as well. So essentially, you can utilize the system to complete forms. The output documents are all customizable, so we chose to have this one kind of a grid-based thing with the provider's signature on it. So essentially, we can customize these sorts of things specifically for you guys. And that's what a majority of our customers do. In relation to, as I mentioned, our surveillance programs, we have not only documentation templates for those items, such as Respirator Fit, Respirator Fitness questionnaires, and I'll kind of show you a few screenshots or a few shots of those, but we use our health maintenance section for that. And essentially, it gives you the ability to set up protocols based on several different things, age, gender, also kind of some employer-based things. And you're able to set up due dates for the specific items that are applicable to that patient, maintain that. We have reports where you can run a report to see what is past due. And then we also have a vaccination section that is essentially utilized in the same way. You can actually give vaccinations in this area. And then by going directly into the vaccination screen, you can click the administer button and actually document administering a vaccination and then also track those due dates. So in terms of the documentation for the surveillance areas, we have, let me go back to Mr. John Williams here. So we have a couple of different ways to document those items. So when you have your pre-employment type items, audiometric testing, you can create templates like this with Agility Screen that will have kind of everything in one big long form with the preferred output that you like. We can also separate those into specific templates so that you have one output document for each item. So again, up to your preference. And then we also have our doctor form formats, which give you a different user interface. So this gives you the ability to document that information in more of a, almost looks like a paper form, where you can document your vital signs, vision testing. This is visual acuity, pulmonary function results, things like that, including physical examination. So it really depends on your preferences in terms of documentation and how you like to do this. We can basically provide samples of the forms we already have, tweak those for you, or completely build them. So this is an HTML form that has been built, customized to look specifically like this. So there are very few limitations for these types of forms, and you can also have links directly to other areas of the system. I don't think this one has it on there, but we can also link directly to the prescription screen, the order screen, other sorts of things directly from this form. So it can take you from here to there and have you do those sorts of things. So for all of those types of programs, you basically would have associated forms. You would have your health maintenance due dates for things that are going to be due in the future. And then we also have reports for each one associated specific to your protocols. Any questions there before I roll on? Alrighty, I'm going to go ahead and jump to the report section since we've kind of got it in a couple different places. So we don't have all of our work comp and occupational reports in here, but I have a good sampling of a few things. Again, we customize this for most practices, so everybody has a little bit different take on how they manage things, and different stakeholders within the organization may need to see different pieces of information. So this is a list of injuries report. This is our health maintenance due report, so you can see based on each patient what items are due. We can also pull things into this, such as their phone number if you need to call them. And we have a reminder section where you can send the patients an email automatically with a reminder that those items are due. And then it also provides a list that you could pick up the phone and call patients if you need your customers, employees to schedule them. So just depending on your particular workflow. We also have our Osha forms. This is the 300. This one's the log of work related. And we don't have a ton of data in this database since it's a test database, but you can at least get the idea. This also tracks our days of work lost as well. And then we have respirator clearance report. You can only have one. So this is a report that shows all of the patients that were given clearance. And then this is a report that shows all the patients that were screened. So a couple different views there. And then we have some practices that look for something like a safety committee report, which pull a few different things in it. So related to injuries, is it recordable, lost days, restricted days, total number of incidents. So multiple different options. And then this is a vaccination overdue report as well. So essentially, we can take any element in those forms or in any of the data input and also capture those into a report. We also, within the patient register, have a lot of different information where we're tracking things, such as in the employer details area, an employment status, department, occupation. And then we also have user definable fields. So if you need some additional information specific to your employees, we can pull those in. This is usually where we track the date of injury and the first lost day. So we can essentially take these and pull these into reports as well. So however those need to be tracked, we can customize that. Okay, role restriction when accessing confidential data. So each patient's register, should have covered that while I was here, has this deny or allow access button, which would basically give you the ability to deny access to any individual within the organization or groups of individuals. So this would specifically restrict this patient's record from anyone that you would like to. So that's one option. We also have what we call roles, and within each role, so I'm going to go to doctor here. So within each role, you can decide what they can do. So here's kind of our little legend: read, create, update, delete, approve for each section of the chart. So you can decide what each role is able to do, and then each user is then assigned to specific roles. So here are all of our access roles. These are more kind of mail roles within the system, and these are a lot of customized ones that we've set up. You can make this as simple or as complex as you want. So depending on what each user has available here, they have access to specific things within the system. So it can be very granular. Tracking service costs by day, month, year. So we have a very robust billing section with a lot of reporting. Essentially what we have done for our occupational customers who aren't utilizing the billing is create some reports specifically for their purposes, but on the EHR side. So this is one example of a report. This has all of our CPT codes generated, including ICD code, total billed, and obviously if you're not collecting payments within the system, we would just have billed. So just a quick example, but basically we can assign those CPT codes and ICD codes to your encounters, even if you're not billing them, and then track them on the back end with the report that is set to your specifications. And those reports can even be set to automatically run and then appear in a specific user's inbox. Regulatory forms specific to Colorado, Montana, and Kansas. I believe we have Colorado and Montana in here. I'm sure we have Kansas. They're super easy to upload if we don't happen to have those. But I will show you the couple of views. So again, 2 possible user interfaces. So here's the employer's first report. So when we preview this, you can see the form that you are probably used to seeing. And then we have the Montana report. And then we also have the physician's first report of, this is the Colorado of injury. So all of these can be easily loaded within the system for you to be able to utilize as a template. And then we also have the doctor form version, I believe, here. So we also have the ability to create these as doctor forms where you're actually putting the data into the form that you're used to seeing if you filled this out on paper. So depending again on which you prefer to complete or how you like to do the data entry, either one can be done. All right, and let me go to prescription here quickly because we are getting close on time. So our E-Prescribe is integrated with SureScripts. Behind this med history button is a 12-month list of all the patient's medications. Behind this detail button is the name, address, telephone number of both the provider who prescribed it as well as the pharmacy that filled it. And you can actually check, select those, hit OK, and populate the patient's current medication list directly from SureScripts. Each provider's prescription habits are memorized in this preferred list, so it will automatically add the things that they most commonly prescribe. All the provider has to do is select those, save. Any interactions will pop up. This is checking between the patient's allergy interactions as well as other medications within their system. And then once you have updated it, hit E-Prescribe. We can also save the patient's preferred pharmacy either within this screen or also back on the patient register. We can also E-Prescribe controlled substances. When you hit that E-Prescribe button, you would purchase a token or a certificate from a company called Identitrust that does the secondary identity confirmation. And so it's an app on your phone. When you E-Prescribe a scheduled medication, it pops up the app on your phone, you put in a secondary password, and it goes through. Case management and treatment notes. So case management we have within the patient register as well. You can track a ton of information on the case management side. Obviously, since you guys are not doing billing currently through the system, this piece of it doesn't matter, but we do have a lot of billing related features on the case management side, which help this information flow directly into the claim, so on and so forth. But you can track multiple cases for a patient, document the date of injuries, the dates that they're out of work, any kind of disability statuses, insurance payers, adjusters, contacts, attorneys, lien on file, any of those sorts of things. And then once a case is completed, you can mark it closed and give it a date, as well as add notes in a couple different places. So nice, lots of information here. And then there's also some user definable fields that you can add to the system that is specifically for this screen. Treatment notes for workers' compensation injuries. So we have, again, a couple of different options for that. So we do have a template-based system where you can actually, if you've treated a patient before, copy forward their previous notes, make changes for today. So we have this green arrow workflow, which takes you from screen to screen, essentially creating your SOAP note. You can preview the information that is being documented from this workflow in this little third panel here. And actually we have this one set up to show the California work comp. But essentially you can utilize a normal progress note and view that information.
You can modify that there, yeah. You can modify by clicking on the binoculars.
Gotcha. Here it's at the bottom too, so we're good. So this information will show you as you save the information in the patient's record what exactly is being populated into your progress note. The nice thing about our physical examination templates is checking this top box marks everything normal, and then all you have to do is uncheck or check the items that are abnormal to make changes. Add notes. You can load lots of things under these little binoculars over here. So it's quick and easy to make notes. You can also load macros and things that you type regularly under these buttons with the binoculars here. So essentially you go screen by screen building your progress note. Our other documentation method is a doctor form. So this is a clinical worksheet related to injury care. So you kind of have everything on one screen. You have your subjective, objective, treatments, plan, work status, and work restrictions, kind of everything on one form. This is a very simple form, but you can make this as simple or as complex as you want to. So this is just kind of another option there. Return to workflow, including notifications to associate manager. So we do have several forms related to work status. So this is a work status report. And you can document any sorts of activity restrictions and things like this. So when you have completed this, if you like a grid type form like this, you can have this. You could also have it be more of a narrative. But this can be automatically sent through the employer portal if you want to give stakeholders within the organization a login, or you can also send this directly from the letters out screen. So you can come in here, have a specific letter for return to work, attach that work status form, send it directly to their supervisor or to the appropriate party, depending on the individual who needs that information. And you can document any specific restrictions and things within that particular document. So that is essentially that piece of it, and I'm going to turn it over to Lynn to talk about the implementation plan.
Good afternoon, everyone. My name is Lynn Hoback. So the implementation plan is typically based on what your requirements are. And standard implementation is anywhere from 4 to 12 weeks. It could be sooner, it could be longer. It truly depends on what your timeline is. We usually start with going through the review of the database, make sure we have everything in there. But we then have our training, which we try to split up based on role, but we also encourage super user roles from your side that would at least be a local troubleshooter for you. And the super user is usually trained first, and we train them on all the different workflows as well as the administrative side of it, and some troubleshooting for modifying templates, creating templates, that sort of thing. But then we break up the trainings we try to do it by role, which would be administrators or back office, front desk and checkout, medical assistants or nurses, and then of course the providers. And we try to break it up so that we do based on the workflow, but then we do all the ancillary items that are included with it. Anything outside of a normal visit or anything else that may have to be done. We base it again on your timeline. And once the implementation, once you are ready and you go live, we usually do testing. We do some mock run-throughs to make sure that the workflows are correct. And when that is complete and you go live, we do some additional hand-holding because a lot of the times you want to do tweaks after you've gone live to see exactly, you'll have a better feel for the program, so you'll know where you want to change things. So we hold on to you for usually anywhere. It truly depends on the size. Someone of your size, we would probably hold on to you for at least 3 months for hand holding to make sure that everybody is comfortable within the system. And then you can be moved into transition to tech support, where we hand you off to our customer success managers, who then again make sure that you're comfortable, hold you within a certain time frame to make sure that you don't need any additional training or anything, and then you could be moved to tech support. Any questions on that?
Jackie, any questions? Anything on the implementation plan? Anything on the product? Or anyone else that wanted to see a certain feature that we did not demonstrate? Please feel free and let us know any questions that you may have.
Yeah, this is Sue again. I'm just wondering about some of those drop downs and oh, I'm going to get the words wrong, but any of the items that could be encountered for an associate, are those buildable? Do you have a library of them, or do we have to create them also? Yeah.
So when you sign up, you get automatically built-in library of OccMed database with all the components that we already have. Then based on your requirement and your needs, we will be able to fine-tune it to your liking. So everything, I would say 80% or 90% of the program is customizable, more or less, with the templates, content, and all those things as such. So the drop downs, yes, that are customizable. The content that is coming in those drop downs, where when you select, let's say, the patient has pain. Now, what kind of pain? There are 5 different categories of pain. You can even add the 6th one if you want on the fly. It could be tailored to that level.
Okay. Okay, great. Thank you.
Yes, if you have subspecialties within your organization, like you have, specific to pain management and things like that, we also have content libraries and other specialties that can also be imported into your occupational med database.
Any other question?
And I may have missed it because I was having a little bit of audio difficulty early on, but did you guys talk about service level agreements with your clients?
Yes. Kemp, you want to talk about that?
Yeah. So one of the initial slides that was there, but in our agreement, we have service level agreement of, what the customer can expect in terms of uptime, turnaround time, with any issues that you have. So if you call us, we have toll-free support, and of course, based on how much an item is impacting your business, if it's not just a simple question but something that you're actually needing help with, it is prioritized based on that. And then we have our support leads group, who's always overseeing our support staff to make sure that those things are being attended to, and if they're very, high priority, then obviously more emphasis is put on those. So yes, our SLA is spelled out, and based on those different tiers of importance, we have a good turnaround there is specified.
And I'm sharing the SLA screen
Okay.
here. If you can see, like,
Oh, great.
this is the one which is there already as a part of the RFP that we submitted.
Oh, okay. Great. Thank you.
Are there any other questions from SCL?
You know, I was going to say, Monica, you could show real quick the resource center if you wanted to. That might be of interest. Or Ramesh.
Yeah, Monica, do you want to show? I'm not logged in on the program there.
Yep. Sorry, I was talking while muted. Yep, I am pulling up my screen now.
So show where, how did you get the screen? Please show that, because that would be important too. So
Yeah, I was planning to. Did it show my screen? Is it sharing? Here we go.
It did a minute ago. Yep, a moment
Okay.
ago.
There we
now,
go.
yes,
It's not
now we can see it.
Okay, perfect. It's not popping up on my preview. So, okay. So the Resource Center is in the top right corner right here. And once you launch the Resource Center, at the top of it has any kind of new specific things. So there's some new QPP, MIPS, Medicaid measures. And then down here, we have a searchable knowledge database, release notes, videos, trainings, webinars. But back here at the top, we have our ability to manage cases. So these kind of work like IT tickets that go in electronically, and they typically respond to these via email and phone. And then you can click here to see the support phone number. And then you can also chat directly from within the system to a member of the support team.
I heard someone else had a question, and I think we could not hear. So did anyone else has any question?
Hi, this is Aman. I do have one. I saw that you guys have a lot of reporting. Do you guys offer any dashboards?
I'm glad you said that, because I was just kicking myself over not showing those. Wow, you're teeing it up great. So we do have EMR as well as billing dashboards. Obviously, the EMR is the piece of it that you guys would be interested in right now, but this dashboard is customizable. You can have up to 9 of them. Each of these fields are essentially running a report in the background, so you can decide what report you want to run. And then within each of the fields, you can click into it to make it larger and then see the underlying data, download it, so on and so forth. So we have a lot of different options on what can be included in these dashboards. You can use them for performance indicators. You can use them for patient outcomes, looking for patients with specific diagnoses or patients with past due surveillance items, any number of possibilities in that. And this is also where we could put your billing reports as well. So if you want to see the CPT codes and ICD codes and those sorts of things in a value-based format that have been, even though you're not billing, but that have been performed, we can also load that into a dashboard type place as well.
Cool. Well, I did have one more thing. I did hear that the forms are really customizable. Do we have forms for different states, like we have Montana and Kansas?
Yes, we do. So I think I have in this database, I have Montana and Colorado, but we can, if we don't have the Kansas in our library, we can definitely load that for you. So essentially, each of the fields within the form get loaded, and then the oops, that was happening.
And Aman, to answer that question, any form, let's say, that you need for any reason it's not available, that's not a showstopper, because we will be able to take it and have that created in the system for you to be able to use it. So that's the benefit that we bring on the table, is that it's an extremely customizable system, and we work with our client to make to their requirement, and we strive to get their satisfaction. So
yeah, and if you need to edit the template itself, you simply double click on an element and you can see the choices in the system. And so you can actually come right in here, add an additional option, change the type of field that it is, change what goes into the progress note or the document template. So it's very customizable, and you can restrict who has access to be able to do that as well.
And just show the setting screens also one. Again, this is the screen from where the whole engine behind the program, everything is being set up and tailored to the practice or the organization.
So each of these basically have a list. So for instance, this is our list of all of our different types of visits. And within each of those encounter types, we have the ability to predetermine the workflow, predetermine templates and forms and things that need to be completed, determine the time. So essentially everything within this configuration area determines how the system behaves and what items, and ties a lot of those screens together.
And only with the people with the respective privileges will be able to do so, not that everyone should be able to do it. So,
right.
I did notice one more thing. You said with the e-prescribing, you need SureScript, or it has SureScript. SCL needs to be on SureScript in order for us to use the e-prescribing. I'm just trying to ask, what if we go away from SureScript? Will e-prescribing still work?
So SureScript is a part of our EHR. So when you're prescribing using our EHR, SureScript is the only one that will work with.
Okay, good
so
to know.
We are providing that to you. You don't have to subscribe to that separately. That's a part of our offering.
So to piggyback off that question though, can we integrate in with our existing SureScripts instance and/or MFA?
We can review that.
So that
nothing is impossible. It's only a matter of time and effort and resources involved and the cost involved. So yes, it is possible, but we'll have to review that.
All right, thank you guys so much. We really appreciate you presenting today. We're going to circle back internally, and I should have an update for you guys here in the next couple of weeks on how we want to proceed.
Thank you again. Thank you all for joining the meeting, and we really appreciate your time. And I'm glad that even though we started with a little technical difficulty that happened, but I think we were able to accomplish whatever we wanted to show within the hour. And thank you all for your patience and for your excellent questions, and we look forward to working with you. Have a great weekend, you all, and bye-bye.
Thank you.
All right, thanks so much. Bye-bye.